So as we conclude day one of this conference, let's reflect on the discussions for today.
And wrap this up relatively rapidly. But reflecting on the entire day is not easy. We've had some really phenomenal presentations by a whole range of experts from different fields. So I'm going to basically focus on session 1 and 2, and I will leave reflections on session 3 for Mr. Basanta and Meera Satpathy to take forward. Now, session 1. What we had was in the morning was a presentation by Vandana in which she stressed the importance of direct participatory learning and action with regard to infant and young child feeding, understanding food groups, anemia, importance of water, sanitation and hygiene, and the importance of campaigns against early marriage, among other issues. She shared learning from community-run creches in decreasing malnutrition in Odisha. She mentioned, results of a primitive tribal groups improvement program in Odisha and work that has been done on severe acute malnutrition and numbers in terms of percentage decreases in severe acute malnutrition based on interventions. But her stress really was on the importance of campaigns for diversification of diets, whether it's in the PDS or the midday meal scheme or the ICDS, and most importantly, advocacy for front package labeling and regulation of advertisements for junk foods, because these are, and warning labels on them, because these are really wrecking the health of the young in our country and actually across the world. Monica Ruiz talked about improving adolescent nutrition, requiring increased support for initiatives that are aimed at addressing developmental needs of adolescents, especially related to healthy nutrition and reproductive and sexual health, and the importance of promoting and supporting health-affirming behavior and habits that carry on into adulthood, and addressing socioeconomic drivers of poor nutrition. And again, what she's stressing, or directly or indirectly, is the same labeling and poor feeding practices that are occurring because of falling into the junk food trap. Though she doesn't put it in those terms, but she refers to the influence of advertising for nutritionally deficient foods is the way that she's presented it, and addressing social determinants of health such as poverty, lack of access to education, lack of access to healthcare. So you're finding resonance in both the presentations on both these factors, this poor quality foods being pushed by advertising and lack of access to education, lack of access to healthcare and poverty, and you'll find this resonating across several presentations. Mr. Basantakar, our nutrition man of India, talked about eliminating, that if we can eliminate anemia, that would increase productivity significantly, and that we need to prioritize actions in the first 1,000 days of life. He talked about the work that Sukarya is doing in this context, and how Sukarya has aligned, its work with evidence-based, what the evidence shows, and that Sukarya's program is community-owned, inclusive, and evidence-based, and it's aligned with India's vision, and it works with government programs and campaigns such as the Eat Right campaign, Fit India movement, Sri Anna, Poshan Vatika, and the importance of dietary diversity. Since I'm referring to Sukarya and Sukarya's work, I think one of the most heartening features of the day was the session before this, that is the inaugural session, during which we heard voices from the communities, and this is a fraction of the communities that actually Sukarya works with, but these were just a few people who came to talk about how Sukarya's intervention had led to increasing the hemoglobin of several women, levels of hemoglobin of several women. But it's not just that. There's a whole host of work that Sukarya does in the villages and slums that it works in. And for me, one of the most important interventions that Sukarya has made has been through education on wheels. And my professor, I studied in the US many, many years ago. And years after I graduated in 1983 with a PhD in agricultural economics from Iowa State University. And my professor who taught me there came to India just a few years ago, about 4 years ago, before COVID. And one of the programs, they wanted to see, rural areas in India. So or a slum in India, or a project being implemented. So I took them to see Sukarya's work with education on wheels in Rangpur Pahadi in Delhi, which is a slum. And I think they were shell-shocked when they saw the deprivation in that particular area, but they were also very heartened by the impact that education on wheels was having on creating educational opportunities for very young and very deprived children. But that's an aside. I'm moving back to the technical session. Sibanti talked about the need for interventions to address individual, household, community, and system-related factors, and to prioritize a systems approach in integrating nutrition-specific and sensitive interventions for women and girls across sectors. She talked about the need to address drivers of food choices, improve access to affordable, safe, nutritious food for girls and women, and address socio-economic and cultural determinants of women's health and nutrition and care. Zoya talked about, using Government of India using life cycle approaches to anemia and for women and girls, and said that the government has always been cognizant of addressing anemia related issues, and that the trends have been measured over many years, and so have issues of iron deficiency, B12 deficiency, vitamin A, sickle cell anemia, thalassemia are all issues of concern, as is the burden of malaria, TB, HIV, etc. But then she talked about 6 by 6 by 6 policies being adopted, and so and that government implements Anemia Mukt Bharat strategy to decrease prevalence of anemia. And in this context, the 6 by 6 by 6 meant 6 beneficiaries, that is 6 interventions, 6 institutional mechanisms. And the challenges that Government of India is facing concern poor compliance, absorption related issues, taste not being palatable, a convergence across ministries, timely procurement and delivering on time, and distribution of supply to the last mile, capacity building needing to be done regularly and on an ongoing basis. Snigdha talked about pregnant women, that if pregnant women are iron deficient, then iron will not be available to the infant in the first 6 months of life, and that this can create lifelong irreversible neurological effects, and the need for optimal nutrition for the first 1000 days, and optimal nutrition during pregnancy is critical, and nutrition during the first 1000-day window is important for a healthier programming for adult life. Umesh talked about very, very interesting processes that they are following in terms of a research study that they are doing, but then he sold us short by not telling us what the findings are from the work that they are doing, and that was very disappointing. In the Indian context, what you would say was, they told us about most of the Ramayana, but they didn't tell us who was Ram and who was Sita. So we're waiting for Umesh to come back and tell us what their findings were, what is more effective, oral intake of iron or IV RN interventions at specific times. The second session which was policy related, we had Deepa Sinha talking about the fact that there's a large scope for government to intervene in making food choices and food availability nutrition sensitive, that we need government intervention because markets don't always deliver, and that the right to life and dignity includes the right to food, that food is not just to fill stomachs, but it has to meet nutrition goals, that there are lots of schemes and programs, but budgets are too low to be able to reach everybody who needs the support. And again, there's also on the supply side, there are vacancies that need to be filled. Uma talked about Nepal and mentioned that there was widespread malnutrition among adolescents and women and mothers, and that fragile health and food behavior that there is fragile health and food behavior of adolescent girls, that we need to address barriers to iron supplementation use, and there's need for increase in focus on effective implementation of RH-related policies and programs. Kapil Yadav, warned us that, that there's a need for us to stop operating in silos, that science, policies, and programs need to talk to each other, that partnerships are key, and that there is a historical context, and we've been trying to deal with anemia for many, many years, but anemia levels have increased, and he flagged two reasons, and both are extremely relevant and interesting. The first reason that he flagged was that diets are worsening, and this then connects with what was said in the first session about wrong foods or junk foods, in a sense, getting pushed, or foods that aren't that nutrition efficient getting pushed. But the second thing that he said is something which is hotly debated in the Indian context, and whereas most of you would not be familiar with those debates, the fact is that the official data sets in India talk about low and decreasing female labor force participation, something that we've been hotly contesting and saying that your data is not capturing the reality. In actual fact, women do a lot of the heavyweight lifting in work in all spheres, and so you're not catching the work they're doing because they don't consider what they're doing as work, and nor do their families. I'm talking about SNA work, economic activity. I'm not talking about unpaid home-based care work. Now, what Kapil Yadav said, he didn't even realize he was, in a sense, throwing out this bombshell in the middle of debates that are raging in other parts of academia. But he said that one of the reasons why anemia levels have increased is because of feminization of the labor force, which means that more women have started working, and therefore you have worsening of diets. So therefore, different people need to start talking to each other and figuring this out. So, but he said that. Anyway, then there's a concern that he flagged, which we know, which is again debated, which is about anemia not being measured by the next round of NFHS, because it's not getting measured accurately, and there are debates around that as well. And that policymakers and program implementers should talk to each other. And he also said that we need a capacity building, and we need to move from nation to state to community, for which capacity building is required. And that cost is hardly a concern in this context, because if you pay 3,000 rupees for an IV or an injection, it's not too much. And that as far as science is concerned, we are at par with whatever's happening globally. But we have to find the resources to apply this science to the benefit of everybody, which again is a very critical point that he made. Sujit Ranjan talked about good nutrition having the power to transform present and future generations, and he talked about fortification, supplementation, dietary diversity. Some of these things are again debated. Fortification in particular is debated, but that's a separate issue. He talked about standards, about ensuring supply, training, advocacy, capacity building, surveillance, and so on. Shweta Khandelwal talked about the importance of multi-sectoral responses in nutrition and the need for a multi-sectoral nutrition governance framework. She said use of frameworks to identify factors affecting anemia would be important and relevant, and that there were three domains: policy landscape in public health and nutrition, innovative approaches and locally relevant solutions in this area, and nature, nurture, and nourishment, or what she called PIN. Shobha Suri talked about challenges to maternal and child nutrition, and said that there were challenges in reaching the most vulnerable populations, that there was inadequate health infrastructure, that socioeconomic disparities and impact of poverty existed, leading to problems in nutrition, that there was the role of gender is important in access to resources and decision making. And she also flagged poverty, unemployment, income inequality, dietary practices, lack of diversity, feeding practices, the need for exclusive breastfeeding for the first few months of life, and immediate start of exclusive breastfeeding, and then subsequent complementary feeding, and sanitation, hygiene, and immunization. So that's basically what I got.
For 2 sessions,
For the first two sessions and a little bit from the inaugural, which I didn't really, which just came in on the side.
Yeah.
I think the session 3 was on behavior change communication and making it a people's movement. Sukarya did lot of homework in designing this session because this is very, very challenging and critical. Because many programs fail because behavior change does not happen or does not happen perfectly. I agree with co-chair Dr. Thomas that this session was really inspiring. Everybody spoke about impact. So let me to start with Dr. Komal Goswami from Plan shared about how they have demonstrated impact in a tribal district or tribal dominated district like Nandurbar and other places, and she shared about application of technology, and most important is they have demonstrated that the village has zero death. So that is completely astonishing or amazing. They have been recognized. Niti Aayog has adopted, Niti Aayog has recognized their best practices, documented it. So that is great. The next speaker was Dr. Amrita Misra. She spoke about infant young child feeding, and more important is using NRLM and the self-help group platform. They have demonstrated it, which is generally people who work on Anganwadi center, but they have demonstrated through using Jivika platform, and that is a scalable model, and government has also started investing on it. Then Dr. Hemang Saha spoke about digital media, and he also spoke about the future of digital media, how it is going to emerge in 2025, and using digital media in their Rajasthan program. They have also demonstrated increase in infant and young child feeding, including breastfeeding and appropriate complementary feeding. And it is really being recognized by the government of Rajasthan. Then Dr. Richa Pandey from UNICEF, she spoke about various perspectives of all-round development. She spoke about emotional development, physical development, cognitive development. So the behavior change communication should focus about all these forms of development. She emphasized that there has to be on behavior change communication, there has to be a life cycle approach. So you have to also focus the mother, child, and many others. Then Dr. Sudhir from PATH, he spoke about various tools. That is very interesting, because PATH is known for its research and evidence-based works and health sector strengthening. So Sudhir speaking about various tools on communication is very important. At the end, Mrs. Neha from Rosni Center talked about again the impact using Poshan Sakhis. They are the women change leaders at the grassroots who have been able to bring changes on behavior. And very interestingly, she spoke about game-based approach. So that is important to learn, and that is important. And that too, she spoke about her work in Bastar, it is tribal area. It is a left-wing left-wing Naxalite infested district. I have my nostalgic memory about that, but really that was good. Sukarya, you have heard lot of behavior change activities. Hearing from horse's mouth, sometimes you say people came from the ground and shared about how Sukarya has been able to demonstrate change of behavior in multiple areas, including infant feeding, not only in infant and child feeding, but also in other areas. So overall, the behavior change communication section talked about new platforms, like Anganwadi could be, SHG could be one platform, new tools. It talks about new volunteers, Poshan Sakhis, and also new technology. So this is unique about this session. Perhaps the time has come when Poshan Abhijan was conceived, we had thought for a Jan Andolan, people's movement. Um, we had many NGOs or many development partners and donors are working parallelly. Perhaps it is time to aggregate those knowledge and work on a behavior change related people's movement. So this is the time I think Sukarya should be able to take it up. Thank you.
I think I will give the vote of thanks to all. You people must be screaming inside your heart that let's go, let's go, let's go, enough. We have served a whole meal platter today. We're all overwhelmed, and I only remember the last line of Pierre, hope. And that is where I am focused always. And I'm going to utilize that, and I'm going to call it a day. Thank you.
Thank you.